Guys, we are live. We'll wait for a couple of minutes so that people can actually join in, then we'll start it.
Nick, hi, this is Abhishek here.
Leona, I think we can start it now. Leona, please unmute yourself.
Yeah. Should we begin or should we wait for a few more minutes, like a couple of minutes? How many have joined in?
So far, I see 150 participants.
Oh, I think we can wait for a few minutes.
Yeah, sure. Leona, let's start it. It's 4-5.
Okay, sure. Good day, everybody. And this is Leona. I have Amol Preet with me today. And we have for you Nicholas Valentino, who's the Senior Director for International Medical Programs at Kaplan Medical. He's been working with students from the last 12 years. So you're working with the real gem of a person here. And Nicholas will be guiding you through medical residency in the US. And things have changed quite a bit after the pandemic, but Nick will be pertaining to all the quintessential features. So we will begin shortly. Nick will guide you through the thing. If you have any queries, you can drop it in the chat boxes, and we will see if we can answer them while we go through the session, or we can do that at the end in the last 15 minutes. But stay tuned and keep your minds to it. Nick will probably cover more points than you have doubts for. So yeah, Nick, do carry on.
Thank you so much, Leona, and thank you everyone for joining us on your Sunday evening, and for SNO for putting this event together. As Leona said, my name is Nick Valentino with Kaplan Medical. I have worked for the past 12 years with students all over the world that are on their journey to medical residency in the U.S. and preparing for the USMLE exams. And of course, at Kaplan, that's what we do. We help our students not only do well on these exams, but put themselves in a position to be successful. And that's what we're going to talk about in this time that we have together today. It's really to try and give you as much information as possible so that you understand the process. And, no one at Kaplan will tell you that attaining a medical residency in the United States is easy. But when you understand the process, when you understand what program directors are looking for, that's how you can work to increase your odds. And that's what we're going to talk about today. How do you put yourself in a position to have the best chances of being successful? Okay, so as Leona said, feel free, put your questions in the chat, but we'll definitely leave time at the end for questions as well. So what's our plan for today? We'll talk about, firstly, why obtain medical licensure in the US? What are the benefits? We'll talk about the application process and the timeline for when you apply. Tips to increase your odds, really understanding the data around getting into residency in the US around different specialties. Talk about the USMLE exams, United States medical licensing exams. These are really one of the biggest hurdles along the way for international medical graduates. We'll talk about study plan strategies for these exams. And then finally, how Kaplan can help. And, of course, as Leona mentioned, we're in a very difficult time right now. I hope everyone is as well. And, I hope that we're starting to see the light at the end of the tunnel with regards to this pandemic. But there definitely have been a lot of changes. We'll touch on those changes in this presentation as well. A lot of the changes are affecting people that are applying this year. So if you're applying this year, there are some different things that you have to be aware of. Whereas if you're applying next year or the year after, ultimately, there'll be changes from where we are now as well. So I really want to try and give you the big overall picture and, of course, answer your questions. But also remember, we have advisors at Kaplan. We have our partners in India, LogicQuest, who are excellent representatives of Kaplan Medical locally in India. And they can meet with you, talk to you one-on-one, and really help plan out your study plan and your residency calendar. But let's dive right in. Another thank you for everyone just for attending this presentation today is going to receive a free ebook of Kaplan's integrated vignettes for step one. The challenging part about USMLE is they don't just expect you to understand medical information. They want to see your ability to integrate your knowledge in a clinical way, apply your knowledge across disciplines, across organ systems, across specialties in one particular question. And that's what this book does a really good job of helping you do, helping you understand the high yield information that's expected of you on USMLE. So everyone's going to get that free ebook for registering, and we'll get that to you in the upcoming days. Okay, so what are the benefits of obtaining residency in the US? Obviously, it's your chance to train and specialize at a high level. And that's really why most international graduates are going to the US. It's that fast pathway towards specialization. So when you're applying to medical residency in the US, you're applying to a particular specialty. internal medicine, family medicine, pediatric, surgery. And then upon completion of that residency, you are then board certified in that area. So then you can continue practicing in the US, you can bring that training back home, or you can go on for further subspecialization, what they call fellowship in the US. So you'll do 3 or 4 years of internal medicine, and then you do cardiology or gastroenterology or pulmonology, and you get further subspecialized from there. All candidates enter the same pool. So whether you're a US graduate or whether you're an international graduate, you're going through a very similar process. You're taking the same exams, and ultimately you're applying for the same programs. Now that's different than countries like Canada, for example, where initial spots are maintained for the Canadian graduates, and then it's like leftover spots are for international graduates. That's not really the way it works in the US. There definitely are some hurdles for international graduates, which we're going to talk about, but ultimately you're competing for the same spots. We need international doctors in the US. We have a shortage of doctors, and we're going to continue to need more and more international graduates to fill that gap, and we'll talk more about that. And then finally, competitive salaries. This is an important one. You guys right now are investing a lot of energy, a lot of time, a lot of money in your education. You want to make sure that that's going to pay off. When you're doing your residency in the US, it is paid. So when you're doing your training, you are getting paid usually about $50,000 to $70,000 US dollars per year. And then upon completion of your residency, US doctors are some of the highest paid around the world. So you definitely have the potential to earn, and that's important. This is a breakdown of the average physician salary in the US. This would be after you completed your residency, what you can expect to earn on average. So you can see, even on the lower end, still very competitive salaries in the US. Okay, and as I was saying, we need international graduates in the US. I'm not sure how many of you know this, but currently 25% of the doctors that work in the United States are internationally medically trained doctors. So a fourth of our doctors went to medical school outside of the US. And the American Association of Medical Colleges is predicting a shortage over the next 10 years, a shortage of general care doctors and a shortage of surgeons and specialists. So we're going to continue to need more and more international graduates to enter the US. This is the number of non-US international graduates that have successfully matched into residency over the past 10 years. So they always break up the data into two categories, and we'll talk about that. A US IMG and a non-US IMG. A US IMG means you're a US citizen or you have your green card, but you went to medical school outside of the US. You're not a US citizen, you're not a green card, well, then you're a non-US IMG. In 2020, over 4,200 non-US IMGs, that's doctors that needed a visa, successfully got started with their residency program. That's the most in history, the most than ever before. Okay, so let's talk a little bit about the application process and really navigating your way through. And again, this is really where Kaplan comes in, helping you guide each step of the way through the application process. And it could seem overwhelming, right? You see all these things, ECFMG, ERAS, NRMP, USMLE. They're making your lives harder than it already is. But again, when you understand what you have to do, when you understand the application process, that's how you can really work to make smart decisions and ensure you're applying on time. So the first thing that every international graduate is working towards is ECFMG, the Education Commission for Foreign Medical Graduates. They're the ones that approve you to take USMLE. So you create an account with ECFMG, they verify your degree from school, and then you get the ability to take USMLE. Step 1, Step 2 CK, and then Step 2 CS, which we'll talk more about. Once you finish your exams, you are then ECFMG certified, and then you're ready to apply for residency in the US. You apply for residency through a system called ERAS, the Electronic Residency Application Service. It's basically just a nice, neat way for you to upload your application. So you upload your scores, your letters of recommendation, your transcripts, your personal statement, which is a one-page essay that you write about why you became a physician or why you chose that particular specialty. You upload all your application, and then you start applying to different residency programs in the US. So you have to think about, well, what specialty am I going to apply to? And you can apply to more than one. You don't just have to pick one, but you have to narrow down where you're going to apply, and then what hospitals are you going to apply to in that specialty. So you have to do your research. Is this program a good fit for me? Some programs are more competitive than others. So depending on your scores, depending on your experience, depending on your year of graduation, you have to make sure you're narrowing down programs where you think you're going to be competitive. And we'll talk more about that. And then you enter the match, the National Residency Matching Program. The match is a process that fits doctors into residency programs. So you have to submit your rank order list. That just means all the places that you interview, you rank top to bottom. So the more interviews you get, the better your odds are going to be. That's the goal. A lot of what we're talking about today is how do I put myself in a position to get as many interviews as I can. So you rank top to bottom. Now, you don't have to worry about, does this hospital like me more than this hospital? You don't have to worry about that. It favors you. So you just put top to bottom where you want to go most to least. So let's say you're shooting for surgery, and surgery is a little bit more competitive than internal medicine. So you apply to 50 surgery programs and you apply to 50 internal medicine programs, and you get 3 surgery interviews and you get 5 internal medicine interviews. You could rank surgery 1, 2, 3. You rank internal medicine below that, and you enter the match. If you're able to match into surgery, you will. But if you're not, you have the same chance to match into internal medicine. Doesn't matter where you put it. That makes sense? It favors you. Excuse me. Okay, so let's talk a little bit about the timeline for applying, and really the timeline for preparing for these exams that you have to prepare for. Now, I'm sure a lot of you are still in medical school. Some of you maybe have finished, but I think a majority are still in medical school. And you're preparing for the USMLE exams. You're thinking about the USMLE exams. Step 1 is going to by far take you the most amount of time. Step 1 is testing you on all of the basic sciences, everything that you're learning the first years of medical school. Now, like I said earlier, it's not just about understanding the information, it's about being able to integrate the information in a clinical way. So it says on average 3 to 12 months. This is going to be different for everyone. Everyone is starting from a different point. Everyone has different strengths and different weaknesses. Now, you're allowed to take step 1 once you've finished the basic sciences in your medical school. So some students will take it while they're still in school, while the material's still fresh in their head. Other students will wait till they graduate, and then they really get started with the process. So it's going to be a little bit different. You guys know things like biochemistry don't stay in your head forever, right? So if you wait till after you graduate, maybe then it'll take closer to 7 to 10 months, where if it's a little bit fresher in your head, it could be closer to 5 or 6 months. The good thing about Kaplan is your scores don't lie to you. You know what your strengths are. You know what your weaknesses are. When you focus on your weak areas, that's how you really see your score improve. But, to be safe, you want to be considering about 6 to 10 months for step 1. Step 2, CK, is testing you on your clinical knowledge, everything that you're learning the next years of medical school. 3 to 9 months, usually about 4 to 7 months for step 2, CK. And then you have step 2 CS, your clinical skills, really your communication skills. Now, this year, for the next 12 months, the step 2 CS has been suspended. So it's not being given right now. Students have to take the OET English exam in its place. So I would expect that next year, it's a different process. But still, you want to be giving yourself about 1 to 2 months for the clinical skills, communication skills part of this process. So you take your exams, you finish medical school, then you receive your ECFMG certification, and you're ready to apply for the match. Now, the match only happens one time a year in the US. It happens every year in March. So just as important as planning your study timeline, you're planning your application timeline. Now, the match happens in March. Applications are submitted in September. This year it's September, October, but usually the goal is submit by September. So you want to be planning your calendar. So normally what I tell students is, you want to have a goal, you want to plan when you're going to apply for residency, but you want to focus one step at a time. Focus on what's right in front of you, and that's how you're going to really do your best throughout this process. So, you focus on step one, you study up for step one, and then you see where you are. If you finish step one today and we're in August, well, I'm not applying this September, right? So I'm not going to do CK, do CS, do some experience, get everything done by September. So I'm working towards next September. And then I have plenty of time to do my CK and do my CS exam, do some experience, finalize my application, and then work towards my calendar for next September. And then I'm planning my residency calendar. So depending on where things go, and sometimes maybe you think step one will take 5 months and it takes 8 months, and then it could delay your calendar. But again, much better to do well on these exams, score above average, because that's going to make everything else in the process that much easier. Excuse me. And then you start your residency program. Residency can be anywhere between 3 to 5 years. It depends on the specialty. And you also have to take step 3. Now, international graduates can take step 3 before they apply or when they're already in residency. The benefit of doing it when you're already in residency is you're already in residency. You already have your job, so the score isn't so important. You just have to pass. The benefit of doing it before you apply is, like we've been talking about, it's a competitive process. So anything that you can do to strengthen your application, program directors like to see that. So it really comes down to your application, your timing. How did you do on the other exams? How much time do you have before you apply? And then you'll make a smart decision about whether you do step 3 before you apply or when you're already in residency. So then you're thinking about your application timeline as well. So the timeline for this year is a little bit different than what it is normally. So I want to talk about what it is normally, because ultimately we expect for next year it to go back to how things have always been. This year is just delayed a little bit. So normally in June, the year that you're going to apply, you go to your ECFMG account and you say, I'm going to enter the match. And they give you a token to open up your ERAS application. And then your ERAS application and your ECFMG account are then linked. By August, all of the supporting document needs to go through ECFMG to your ERAS application. Your letters of recommendation, your personal statement, all those things you'll start uploading. In September, you start applying to residency programs. September 6th is when you can start applying. September 15th is when programs start getting the applications. This year, they don't get the applications till October 21st, so there's more time. But normally, they start getting the applications as of September 15th. Regardless, the goal is to apply as early as you can with a complete application. The longer you wait to apply, the less likely your chances are getting interviews. So somebody could say, oh, you can apply anytime, September, October, November. And that's true. But the longer you wait, the less likely those chances are getting interviews. So the goal is by September, complete application, ready to apply. November through January is when you'll go on the majority of those interviews. February is when you submit that rank order list. And then in March, you find out if you matched, where you matched, and ultimately on July 1st, you start working as a doctor in the hospital in the US. And then once you start working as a resident in the hospital, you dive right in. You're a first-year resident, you're working with other physicians, and you are immersed in the healthcare system in the US. And I would say, most people in the United States don't really know the difference between resident and physician. You know, when they're in the hospital, they just see doctor. Me, obviously, I know the difference because of what I do. And just this past couple of weeks, I was in the emergency room with my son. He was fine. He's 4 years old. He had a little bit of a sprained wrist. So we go to the emergency room. We're getting X-rays. You know, he's crying, and doctor walks in. She seems very nice. She was an Indian doctor, and she comes in, and I see on her chest it says PGY1, and we're in August. So I'm thinking to myself, oh my God, this lady's only been a doctor for 1 month, and she's going to help my son. But she was great, and I'm sure you guys are going to be great when you dive in. But still, they always say in the United States, if you're going to get sick, you don't want to get sick in July, because you have all brand new doctors in the U.S. Okay, so I'm sure a lot of you are wondering, well, what are my chances? How successful are international graduates in the match? So let's talk a little bit about some of the statistics. In 2020, this year, this was the match rate, the success rate for the different applicants. So you have your U.S. seniors. U.S. seniors always have a high match rate, about 94%. That's usually where it falls. And then you have your international graduates. Like I said, U.S. international graduate or non-U.S. international graduate. A U.S. international graduate, U.S. citizen or green card holder, non-U.S. international graduate, not a U.S. citizen. So you can see not much of a difference. 61% of the international graduates that entered the match were successful. Ultimately, those are good statistics. That's the highest success rate that international graduates have seen in 30 years. And remember what I told you, more international graduates matched in 2020 than ever before. So you have a higher success rate in 30 years, and you have more doctors matching than ever before. Ultimately, these are things to be optimistic about. Now more than ever, opportunity is there. But then it can be quick to think in your head, oh, it's getting easier. And that's the important thing to remember. It's not getting easier. It's as competitive as it's always been. The doctors that are taking their exams are doing well. They're getting experience. They have well-rounded applications. It just means that you have to make sure you are above average. When your application's above average, that's how you put yourself in a position to get interviews and ultimately get your spot. When the application's below average, it makes getting those interviews that much more challenging and ultimately getting into residency that much more challenging. So how do I get those residency interviews? You have to get your application looked at. Okay, so when you're going throughout this process, it's important to understand the whole process like we're talking about, but it's also important to think like the program directors think. You're applying to all these programs, and then the programs are getting all of these applications. So the average residency program is getting about 2,000 applications for maybe 10 to 15 spots. So they do not have the time to go through every single person's application, look at your letters of recommendation, your personal statement, all the experience that you have. They just can't do that for every person. So what every program does is they set up what they call filters. Now, the challenging part is every program is different. Every program can pick what their own filters are going to be. Okay? So they asked program directors in a survey, they asked over 1,200 program directors, of all the applications that you get, how many of them do you reject and how many of them do you give a full in-depth review? Excuse me. And you can see it's about half. About half of the applications get what they call filtered out. So if your application's below average, it could make getting to the next level of the application process that much more challenging. It can make getting your application looked at that much more challenging because every program is going to set up those filters. So let's say a program gets 2,000 applications and they say, 1,000 applications, and they say it's 1,000 on average, and they say, okay, nobody below 230 on step 1. Nobody below a 230 on step 2. Nobody that failed any of their exams. Nobody that graduated more than 10 years ago. Go. And then maybe the 1,000 becomes 400. Then they go to the rest of the application. Look at your letters, your experience, your personal statement. Then they're going to choose who to interview, and then they're going to choose who to rank for their program. So you have to understand the way that this process goes so that you can make smart decisions about your application, okay? So why is this important? Take something like clinical experience in the United States. Getting some experience in the U.S., working in a healthcare setting, getting a U.S. letter of recommendation, that's an important part of the application process. Program directors like to see that you have some experience in the U.S., but you have to understand where things go. I've worked with thousands of students, and almost every student that I work with, right when they're getting started, they're thinking about doing their clinical experience at a big name institution, something they've heard of, right? Like Johns Hopkins or the Mayo Clinic or Harvard. But it comes down to the application. If you have a 250 on step 1 and a 250 on step 2, well, then I would tell you go for it. If you want to go rub elbows with some fancy doctors and strengthen an already strong application, go for it. You're already going to be in a position to get interviews, and that's going to make your application even stronger. But if your application is average or even below average, well, then you're thinking about clinical experience more for networking, for meeting programs, for showing them that you're a hard worker, that you're a team player. And then ultimately, you're going to want to pick places that you could see as a potential landing spot for you that are IMG friendly. I've worked with, like I said, thousands of doctors. So many doctors that I've worked with have only gotten one interview, but still gotten into residency because they put themselves out there. They got experience. They showed programs that they were a hard worker and they were going to make their program better. And then maybe they were willing to overlook a, below average score. So you need to be thinking about these things as you finalize your application. Those big name institutions, maybe it makes your application look good and it's impressive experience, but they may not lead to the type of networking that you need to help increase your interviews. Those programs, maybe they'll accept IMGs for volunteer work or for observerships, but those are not IMG friendly programs that would potentially give you an interview. So you got to think about your application. How do you make smart decisions to strengthen your chances? And then think about other little things, a part of your application. Think about your personal statement. It's a one-page essay that you write about why you became a physician. Think about where it comes in the process. They get 1,000 applications, then they do their filter, and now they're down to 400. Then they're digging into the applications. They're looking at your letters. They're looking at your experience. They're looking at your personal statement. If your personal statement's not well written, spelling mistakes, things like that, that's all the reason they need to put you in the no pile, right? They're looking for reasons to put people in the no pile. It's who are we going to interview? Who are we not going to interview? And guys, continue to put your questions in the chat. They'll send me over some questions now. So feel free to put them in, and we will cover questions at the end as well. So guys, keep ahead firing them away. I appreciate it. So again, every part of your application needs to be as strong as it can be so that you're putting yourself in a position to get those interviews. You don't want to let something like a poorly written personal statement be the reason why maybe you don't get 3, 4, 5 interviews. But it comes down to those USMLE scores. The better you do on USMLE, the better your chances are going to be at getting those interviews and ultimately getting your spot. So let's talk a little bit about that. What are the average USMLE scores needed to be successful? So what do you guys think out there? What's the average step 1 score for an international graduate that matched into residency? .234. So 234 is the average step 1 score for non-US international graduates that matched. What do you think about unmatched, doctors that were not successful? Actually 221. So 234 for those that matched, 221 for those that didn't. So if you're thinking about USMLE, you're thinking about residency in the US, you can't be thinking about just passing. You have to be thinking, how do I score above average? And remember I said it's not getting easier? Well, this is why it's not getting easier. 10 years ago, the match rate for international graduates was about 40%. But 10 years ago, 221 was a pretty good score. So that's why it's not getting easier. Doctors are doing better on these exams. You have to make sure your sites are above average. Step 2, about the same thing for step 2. 240 for those that matched, 228 for those that didn't. So these have to be your goals. Some people are asking about what happens when USMLE for step 1 goes to pass-fail, and we're going to get there in just a minute. That's for step 1. All right. Now, like as I was saying, the better you do on USMLE, the better your chances are. And right now, and we're going to talk about the changes to USMLE in just a minute, but right now, step 1 is the most important factor for program directors in deciding how to interview candidates. They asked program directors in a survey, 94% of them said step 1 is the most important factor in how they interview their candidates, how they choose people for interviews, how they do those rankings. So ultimately, the program directors I spoke with, they're not very happy about step 1 going to pass-fail because it makes differentiating between candidates that much harder. And we'll talk about that. But right now, the better you do on step 1, the better your odds become. For internal medicine, if you look at your score, you could see your odds of matching based on your step 1 score. International graduates with a 250 or better on step 1 have over a 90% chance of getting into internal medicine. So you're putting the odds into your own hands. And getting these scores is very possible. At Kaplan, we have what we call the Kaplan Medical Honor Society. It's just when we celebrate when students score above a 250, and almost every week we're adding new names to that list. So again, the good thing about Kaplan is your scores don't lie to you. You know what your strengths are, you know what your weaknesses are, you know when you're ready to score above average, and then you know you're putting the odds into your own hands. And really quickly, here's a breakdown by specialty, so you have an idea of what you're shooting for and what you really need to work towards. You could see something like family medicine, much more friendly than general surgery. So if you're thinking about general surgery, you have to set your sights even higher to be above average. Okay. All right, so let's talk a little bit about USMLE. And before we go into the actual tests themselves, let's talk about some changes that have been announced over this past year. And a lot of these changes were announced before the pandemic. So there's been changes even since the pandemic, but before the pandemic, they announced that they were making some major changes to USMLE. The first one was the most major change, that no sooner than January of 2022, so January 2022, no sooner, they would be moving step 1 from a scored exam to a pass-fail exam. So we'll talk more about that. The other thing that they were changing was they were reducing the maximum number of attempts. So right now, if you pass USMLE, that's your score. You can't take it again for 7 years. If you fail, you can take it again, but that hurts your application. They're changing it so that it used to be you could take it 6 times. Now you can only take it 4 times. If you're taking the exam that many times, your chances really go down. So the goal is do as well as you can on your first try. That change was supposed to be implemented a couple of months ago, and they already delayed it. So if that's an indication of other things, the step 1 to pass-fail, again, you have to potentially anticipate it's not ready by January 22. That's the earliest. And then the final change that they're making is you can't take the step 2 CS exam without first passing step 1. So you have to do step 1 first, whereas now you could do them in any order. But because of the pandemic, Step 2 CS is currently suspended. So something that you have to prepare for as well. So the most important thing is, understanding the timeline and how things affect you as an applicant. So they made their first announcements this past February. They made updated announcements in May. And then January was when they were supposed to do the reduced attempts. They delayed that. The earliest date for the Step 1 before CS was supposed to be March of next year. But like I said, as of right now, Step 2 CS is suspended. And then the earliest date for the switch to pass-fail is January 2022. So what you really want to be thinking about is, when am I taking Step 1, and when do I plan on applying for the match? We have some people in this room today that I'm sure are going to be doing Step 1 before the change. Like, they know I'm going to be doing Step 1 before January 2022, so I'm preparing for a 3-digit score. You maybe have some people in the room that just starting school, or they're early on, and they know I'm taking Step 1 way after January 2022. And then ultimately, there are unknowns. We have to see how trends develop. We'll talk about what we can anticipate and what to predict. But again, you have to see how the trends develop, how it affects international graduates, and what other parts of the application become more important. And then maybe you have people ultimately that are on the fence. Maybe I'm going to take it before, maybe I'm going to take it after. Ultimately, if you're an international graduate and you can take Step 1 before the change, you should. International graduates want a way to stand out against their competition. The better you do on Step 1, the better your odds are. And like I said, when Step 1 goes away, other things become more important. Your Step 2 score, you're having a Step 3 score, no failures, your clinical experience. So, of course, those are all things that you're going to work on. But right now, Step 1 is the most important factor in standing out against your competition. The other thing to think about is when you're going to enter the match. So USMLE, they announced that if you take Step 1 before the change, whenever you apply, your score will be reported. So if you take Step 1 and let's say it happens January, like they're planning, which probably will be delayed. Let's say you take Step 1 in December 2021, you get a 3-digit score. When you apply, that 3-digit score will be shown on your application. So if you're applying for the match in 2023, virtually everyone in that match still has a 3-digit score, right? You're not taking Step 1 in January 2022 and then applying in September of 2022. So everyone in that match still has a score on Step 1. The 2024 match, same thing. You maybe have a few people starting to apply with a pass-fail, but a majority of people still have a 3-digit score. It's not till the 2025 match where you start to see a larger percentage of people applying with pass-fail. So for the next 5 matches, having a 3-digit score is still going to be a big advantage. And even after that, it's still going to be a way that if you score 250, that's going to be a way to stand out against people that maybe just have a pass-fail. So again, think about your timeline. No sooner than January 2022, especially if you're thinking about 2023 match or 2024 match, you're thinking about getting a score on Step 1. Remember, you want a way to stand out. If you can take Step 1 before the change, you should. Right now, it's the most important factor for program directors in deciding who to interview. And remember I showed you the match rate? You have US IMG and non-US IMG, and they were about the same. Non-US IMG is actually a little bit higher, 61%, 61.1 versus 61. Okay. Now, US IMGs and non-US IMGs, they are from all over, right? You can have a US IMG that goes to medical school in India, vice versa. but a majority of those categories, when you look at USIMG, a majority of it's the Caribbean. So students that they go to medical school for 2 years in the Caribbean, and then they do 2 years of rotations in US hospitals, okay? Whereas a majority of non-US IMGs is they go to medical school and they do their clinical rotations elsewhere. So you saw the match rate's not much different, 61%, 61%. If you look at the scores though, USIMG, it's a little bit more friendly. The average score for step one's about 220-ish, whereas we saw the average score for a non-USIMG is about 234. So what does that tell you? USIMGs are getting a lot of clinical experience, but it's still showing you that scores are more important. A program director is going to be more likely to take a non-US IMG from India with a 250 on step one than maybe a US IMG from a Caribbean school with a 220 on step one, but that has a lot of experience, right? So maybe the non-US IMG's got a little of experience and a really great score, a lot of experience and a below average score. Right now, the numbers show you they're going to take the person with the higher score. Well, what happens when step one goes to pass-fail? Who are you going to take? They both have pass. You're going to take the person with more experience, the person that maybe part of residency is training, but it's getting people that you know are going to be good workers, that show up every day, that aren't crazy. That's half the battle. So when step one goes to pass-fail, it becomes harder to really differentiate between the best of the best candidates. And then you have to go on other things. So like I said, international graduates want that way to stand out. And when step one goes to pass-fail, other things become more important. So obviously you have to pass, but then you're looking at step two score, you're looking at step three score, you're looking at no failures. Right now, if you have a failure, it hurts your chances, but there are still many programs that will give you an opportunity for an interview, even with a failure. After the change, that probably becomes more challenging. Right now, your performance in medical school really has very little weight. That's why USMLE is so important. Perhaps, again, we have to see how trends develop, but we would anticipate all these other things become more important. Clinical experience in the US definitely becomes more important. Letters of recommendation, year of medical school graduation. A lot of people think right now, if I graduate more than 5 years ago, my chances are done. And that's not the case. The average for international graduates that are successful, it's 4.7 years from when they graduate to when they match. So it's very common for international graduates to graduate, apply for 1 or 2 years, and then, prepare for 1 or 2 years, maybe do a year or so of experience in their country or work in their country, then apply for residency. Okay. I'm getting a couple of questions. Some people ask about the new criteria for applying for residency. So what I want people to not be confused about is, what we're talking about today is the normal process. So if you're planning on applying next year or the year after, really everything that we're talking about is really what you're planning towards. And, of course, we're in a new world right now and things could potentially continue to change. But this is the way that it's been for, the past 20 years. Because of the situation this year and people couldn't take the Step 2 CS exam, which is an important part of the process, they had temporary changes to the accreditation process to allow people to apply this year. So I don't want to spend too much time talking about that, but if you're applying this year, there's a special route that you have to go to get ECFMG certified. So what I would encourage you is if you're applying this year, Google, residency requirements for IMGs in 2021, and you'll get the list. Basically, there are some stipulations. You couldn't have failed the exam more than twice, little things like that. You have to pass the OET exam, and then you have to go through a series of pathways to get your ECFMG certification this year. Again, this is a temporary solution to allow international doctors to apply this year because we need international doctors, as you've seen. But we fully anticipate it's going to be a completely different process next year. So you have to stay connected. Again, focus on what's right in front of you. A lot of people, too, are nervous about getting started because of all the unknown. But that just delays your journey. It delays, if you're planning on getting residency in the U.S., this is a journey. It's a investment that you're making in your future. And you have to focus on putting yourself in a position to be successful. Everything along the way does that. So you focus on your USMLE exams, and then as you're getting close to the application, Kaplan helps you put yourself in a position to make the best decisions.
So we also,
go ahead, sir.
We also have a question about how would we strengthen our CV once it becomes pass or fail?
Right. So once it becomes pass or fail, the way to strengthen your application is do as well as you can on step 2, getting a step 3 score so that maybe that you have that and other people don't. And then it comes down to the experience that you have. So we're getting questions too about what's the difference between an observership and a clerkship and an elective. And it's a great question because I tell this to students all the time. Don't worry so much about what it's called. There's not a lot of regulation in the US around clinical experience for international graduates. There's a lot of different providers out there, but they call these things all different things, right? You have clerkship, externship, internship, observership, preceptorship, rotation, elective. Don't worry about what it's called. Worry about the who, the what, the where, the why, the when. That's what they're going to see on the application. It's not going to matter, observership or elective. It's going to matter who were you working with, where were you working, and what were you doing? Now, you may see a program, they advertise, oh, we have this hands-on clinical experience opportunity in internal medicine. And you say, oh, that sounds great. Let me sign up for that. And you show up and you're at a private doctor's office and you get to interview patients and help out, but you don't see a hospital setting at all. Is that more valuable than working in a hospital setting, observing a residency program and shadowing a doctor? What's more valuable? There's value in both, right? You can argue both, but you want to know what you're signing up for. In general, getting some type of exposure in a hospital setting is what program directors like to see. They understand the residency program, the flow of residency program. You're starting to understand the electronic systems and records, all things that you're going to be learning as you start your residency program. So any experience is good experience. You want to get a good letter of recommendation. They want to see that you are a hard worker, that you're going to be a good fit for their program. So any experience is good experience. Take advantage of what you can, but it comes back to your application. You have to make smart decisions based on your application. And if you have a strong application, good scores, good experience in your country, relatively fresh out of school, well, then, you have more options. Like I said, if you want to go to a more US-friendly place to do your experience, that's fine because you're already going to be in a position to get interviews. So you want to be asking yourself, why am I doing clinical experience? Am I doing clinical experience to strengthen an already strong application? That's great. That's the goal. Or am I doing clinical experience really as an opportunity to network, to meet programs, to show them I'm a hard worker, and that could potentially lead to an interview or 2 interviews that leads to my spot. For many years, go ahead.
We have a few sequential questions about the same thing. People want to know that does internship in India count, and whether is it advisable that they should pause their internship in India and go to US for a clerkship, or is there any chances of getting a rotation, clinical rotation, elective or clerkship post internship as well?
Yeah, you could definitely do both. getting experience in your country is definitely valuable. Program directors like to see that. Getting licensed in your country is good. So doing your internship in India, I think that's a good move, especially if you plan on coming back to India at some point to practice. It's not necessary. A lot of people graduate from school, they take their exams, they get some experience in the US, and then they start their residency program. So I would say it doesn't hurt you. Getting the experience is good. It just doesn't count as US clinical experience. Taking a break and then doing an elective or internship, you can, if an opportunity pops up and you can go and do it, I think that's good to do. Take advantage of what's out there, but you're allowed to do it after you finish your internship as well. It doesn't matter if you're still in school or after you're in school. Now, there may be some opportunities that are associated with your school. So like if your school has an opportunity where you can go to the US and do a rotation or an elective, that's a great opportunity to take advantage of. But there are many companies in the US that have clinical experience opportunities around the United States that you could sign up for. Whether you're a graduate, whether you're, done your internship or not, it doesn't really matter.
So there's also a question about research projects. What is the importance of research projects in a CV? And does research projects in India count the same as research projects in US or anywhere else?
Yep, great question. So yeah, research definitely helps. Any experience helps. So whether it's in India or whether it's in the US, program directors like to see that. Just like when you're applying to college, you want to have all of those extracurricular activities. It's really the same thing. The more that you can show that you're invested in your education, your medical future, program directors like to see that. Now, you don't want to go too heavy on the research. Like I was working with a student the other day. He had, I think, 10 different research opportunities and no clinical experience, hospital setting experience. So you want to balance it out. Some research is good, but like I said, program directors like to see time in a hospital setting. The thing about research is some specialties prefer it more than others. So it's going to help. Of course, it's going to help. But like when you look at the statistics, on average, like a program like neurology or pathology, they have generally more average research experience than, whereas internal medicine, if you have to pick between doing some research or doing time in a clinical setting, they're going to lean more towards the clinical setting. So you want to have that balance. But definitely, research helps. It shows programs you're committed to your education and to learning and becoming a better doctor. The thing about research to remember is two things. One, you want to give it enough time. You can't put 3 weeks worth of research and then think that that's going to have a value. When you're thinking about research, you're thinking about a 3-month or more commitment. You want to have something to show from it, whether it's a paper or your findings. And then the last thing to remember about research is you have to be prepared to talk about it. So when you put it on your application, program directors like to ask you about it. It's a good conversation starter. Oh, I saw you did some research in this. Tell me about it. What was interesting? What did you find out that surprised you? So you got to be prepared to eloquently talk about your research when you're putting it on your application. So just something to think about. But definitely it helps. Anything helps in terms of strengthening your application. But again, it comes back to your application. If you have a 210 on step 1 and a 210 on step 2 below average scores, you have to understand that getting interviews from programs that don't know you is going to be a challenge, right? So it's how do then I put myself in a position to network and show programs that even though I maybe have a little bit below average scores, I am going to be a good fit for their program. For many years, I was the director of the New York Kaplan Center. So I would work with students coming into New York Center from all over the world. And we had a student that came in, this was a bunch of years ago at this point, maybe 6 years ago now. She came in, She did below average on step 1, below average on step 2, and then she failed step 3 when she was taking it. This was a U.S. doc. She was a U.S. citizen, but she went to medical school in India. She came to Kaplan for step 3. So of course, we helped her prepare for step 3, but I told her, based on your application, you have to get experience. You have to put yourself out there, meet programs, show them you're a hard worker. And she did experience at a hospital in the Bronx, New York. New York's where I'm from, if you couldn't tell from my New York accent. She did her experience at a hospital in the Bronx. She got one interview, and then they gave her an opportunity for residency. She texted me the other day to check in and said, "Do you remember me?" And she always stood out in my head. So I said, "Of course I remember you," telling me that she was starting this year as the chief resident. So, there could be so many different routes towards your success. This was somebody that, 5-6 years ago thought that she was never going to get into residency. And this year she is serving as chief internal medicine resident at a very busy community hospital in the Bronx. So there could be so many different routes towards success, but yes, ma'am.
Sorry, sir. We have 2 more questions about CV. What extracurriculars are advised, and what is the role of international conferences?
Phil, a second one again, I'm sorry.
International conferences. How beneficial is it to attend some international conferences, and how do you maintain a network in the US while staying in India?
It's a great question. So, again, it really comes down to the full picture, right? So, the more the better, like the program directors want to see that you stay active. They want to see that you are doing everything that you can to focus on your education, to focus on clinical experience. So, all these things are good, but, attending 2 extra international conferences, is that going to make the difference between an application or not? Generally not. Again, like I said, the more the better. They want to see a well-rounded application, but it comes down to these other factors in determining how you get to that next level of the application process. So yeah, I think attending these conferences is good because 1, it helps with the networking. Going to these conferences, that's a major part of it. Meeting people, learning new things, learning about new opportunities, whether that's research, whether that's clinical experience, maybe potentially meeting US doctors. So there's a lot of value there. Does it make a big difference on your application? A little bit, not major. How do you maintain your connection while you're in India? I think, again, it's, well, where are you in the application process? If you're focused on studying for step 1 right now, I wouldn't be worrying about networking. I'd be worrying about doing as well as you can on step 1. And then as you're doing step 2 and step 3, and then thinking about your application, then you're really finalizing any experience that you need. You're finalizing those networking opportunities. So while you're in India, anything that you can do to stay active, like attending these conferences, different things like that, is important. I know right now, telemedicine is becoming a new normal, right? I think in the next 5 or so years, it's going to be a major part of how doctors are interacting with patients. If you asked me last year, does a telehealth rotation have a lot of value? I probably would have said no. And now that's completely different. So people can't travel right now. Certain clinical experience opportunities are opening back up, but a couple of months ago, that wasn't the case. So if you're stuck in India, you can't travel, and you can't really get clinical experience opportunities, if a program director sees that you sign up for a telehealth rotation or an elective where you're working with a US doctor, you're sitting in on telehealth appointments, you're getting some of that experience, that's a good thing to do. Again, it shows programs that you're committed to strengthening yourself regardless of the situation. So you can't travel right now, but you're still doing what you can to put yourself in a position to have a stronger application. So I anything along those lines, I think program directors like to see. There's a virtual research opportunities that you can do in the US where you're working on a project remotely. So again, it's just about staying active, thinking about your application, and then making smart decisions about your application.
So how do we apply for these electives and observerships? What is the application process?
It's a great question. There's no formal system in the US, and that's why it's a challenge. I would encourage you, stay connected with Kaplan. Just this past week, I did a whole hour just on clinical experience for our students. What is it? Difference between volunteer work, research. So we could talk about it for a long time. So stay connected with Kaplan. We have free lectures, free seminars on all these things as you're preparing for your application to help you make smart decisions about experience, interviews, your personal statement. The thing to remember is there's no formal system in the US. You either have to do research on your own. So that's, visiting hospital websites, going through your student organizations. Generally, I would try and narrow down a region. Let's say you have family in New York or New Jersey. Okay, I'm going to narrow down New York, New Jersey, Connecticut, and just start researching hospitals, Googling their website, looking at their volunteer opportunities, experience opportunities, research opportunities. And that's a tedious process. You may have to send 100 emails to find an opportunity, but sometimes you can do that and you find an opportunity for free. Another thing to do is network with any connections you have, colleagues, friends, family, your school, anything that could potentially open up an opportunity. That's another route to go. The other thing is looking for a provider that has these opportunities that you can pay for. And there's things to consider with regards to insurances and different legality of being in a hospital when you're not a certified physician that they help you with. So it's, it could be anywhere between $2,000 to $4,000 US for a month clinical experience opportunity, but it takes a lot of the pressure out of finding those opportunities. The biggest thing that I always recommend students do is make sure you ask questions. I personally think this is a good investment in your application that you should prepare for, but you want to ask questions. Like I said, some programs will say we have this hands-on internal medicine opportunity, and you sign up and it's not exactly what you thought you were getting. Kaplan, we recommend AMO opportunities. They're a great organization that generally are going to give you good customer service and give you high quality experience opportunities. So you talk to our advisors at Kaplan and they can help you get set up with that when you're ready. And they can even get you discounts on these programs when you're ready.
I think, sir, we'll take the rest of the questions at the end. You can continue with the session. It's been
no problem. Keep the questions coming. All good stuff, and these are all very common questions. So, great questions. We are almost working our way through. Last thing I want to touch on are the actual USMLE exams. What are they testing you on? Just what to be prepared for. So like I said, USMLE, United States Medical Licensing exams, your ability to integrate your knowledge that you're learning in medical school in a clinical situation. So step one is testing you on all of your basic sciences, everything that you're learning the first years of medical school. It's an 8-hour exam. These are long exams. It's a computer-based exam, multiple choice questions, and they're given all over the world. You don't have to travel to the US to take it. You can take it right in India. Now, the passing score is 194. Now, remember, no one's thinking about just passing. You have to think about above average. So right now, that's 234 or better. And like I said, long exams. Yeah, you have to prepare for an 8-hour exam. At Kaplan, we're giving you 2 full-length simulated practice exams to do before your actual test to make sure you're ready for an 8-hour day. Step 2 CK is testing you on your clinical knowledge, everything that you're learning the next years of medical school. 9-hour exam, so again, long exam, computer-based, multiple choice questions given all over the world. So you don't have to travel to the US for either of these exams. And then you had step 2 CS. So step 2 CS was testing you on your clinical skills. Like I said, really your communication skills. Now, the challenging thing is right now, step 2 CS is suspended for the next 12 to 18 months. And my estimate, my guess is that when Step 2 CS comes back, there's going to be some changes to it. I wouldn't be surprised if they made Step 2 CS much more like a telehealth appointment, becoming a more important part of the exam, part of medicine. So actually doing a virtual clinical encounter, I wouldn't be surprised if they went in that direction. But as of right now, it's suspended, and students this year have to take the OET, the Occupational English test, to get the clinical skills certification part of this process. The old Step 2 CS exam was a live, patient-based exam only given in the US. So you have to stay tuned for changes that are happening. Kaplan will continue to provide these updates, but ultimately they're going to test your communication skills some way. And then the last exam is Step 3. Step 3 is testing you on all of your long-term patient care, the unsupervised practice of medicine. Now, you can't take Step 3 until you've done the other exams. Until you're ECFMG certified, you can't take Step 3. So you have to get that ECFMG certification first, then you can do Step 3. But like I said, you could do Step 3 before you apply or when you're already in residency. Okay. What's the best way to get a high score on USMLE? A lot of people will think study, and that, of course, that's the truth. But really, the most important thing is just to follow a study plan. It's too much information to just dive in on your own. And, I've been working for Kaplan for over 12 years. I am very confident that we give you all of the resources that you need to score above average. But regardless of what you decide is best for you, the most important thing is just having a plan, organizing yourself. It's too much information to just dive in and say, okay, I'm going to watch these videos, then I'm going to read this book, then I'm going to study this, then I'm going to study this. It's too much information. I've worked with thousands of students. You don't know how many students have come to Kaplan after studying for 5 or 6 months on their own, and it basically feeling like they're starting from day one because they've been so disorganized. They don't understand what their strengths are. They don't understand what their weaknesses are. You want to provide structure to your preparation time. How much time do you have per day? Maybe you are still in school. Maybe you're a graduate. You want to be realistic with yourself. Sometimes students will come up to me and they'll say, I want a study plan for USMLE. I want to study 8 hours a day. By the way, I'm still in school and I work at night, but I'm going to study 8 hours a day. And you have to be realistic with yourself. How much time do you have that you can meet your goals? Maybe it's only 4 hours a day or 3 hours a day in the beginning, but you want to make that plan and you want to stick to it. 5 days a week, 3 hours a day, I'm preparing through different topics. You want to approach content areas strategically. That's 2 parts. One, obviously, you want to spend your time focusing on the most exam relevant information. What are the high yield topics and concepts and subjects? That's where you want to focus. But you also want to focus on your own strengths and weaknesses. That's how you start to see your score improve on USMLE. It's a lot of information. It's about understanding what are my gaps in knowledge? What are my strengths? What are my weaknesses? You identify those gaps, you address them, you fix it, and then you move on. That's how you start to see your score improve. Some subjects you're going to be able to move through much quicker. Some subjects you're going to really have to spend more time and remediate your gaps. Every country is different in terms of how they cover information, what they focus on, and that's what you have to address. Where are my gaps in knowledge from what I learned in school to what's expected on USMLE? This is an important one. You want to have time for content and you want to have time for questions. And that's a mistake I see a lot of students make. They spend too much time focusing on questions and not enough time really studying the content, building their foundation. USMLE, you need to have a strong basic and clinical science foundation, and then you have to be able to integrate your information across disciplines, across organ systems, across specialties. If you're really weak in biochemistry, well, then it doesn't matter how strong you are in other subjects. when you have a question and you need to integrate that knowledge, you're going to struggle. So you have to balance content and questions. At Kaplan, you're always doing both. It's a balance of content and questions. In the beginning, it's heavier on the content. You're going through subject by subject and building that foundation. You're always doing questions, but more topical questions. You're studying anatomy, you're practicing anatomy questions. You're studying biochemistry, you're practicing biochemistry questions. As you progress your way through, it's less and less content and more simulating the exam and getting ready for exam day. You're going back to the content only when you need to. And you have to learn from your mistakes, and that's a big one. So anytime you do a question with Kaplan, you get a robust explanation on why the correct answer is correct, but why every incorrect answer is incorrect. So you really learn from your mistakes. And that's when I talk about addressing your gaps in knowledge, that's what I talk about. You do a quiz of 10 questions, okay, and then you go through and you read every explanation, whether you got it right or whether you got it wrong. The people that are doing exceptional on USMLE can take one question and turn it into 5 questions. When would A be right? When would B be right? When would C be right? When you understand the questions that way, that's how you know you're really ready to score above average. But you do a question, you read the explanation. Sometimes you read the explanation and you say, oh, yeah, I made a mistake. I knew that. And you move on. You fix it. Easy. Sometimes you read the explanation and you're still confused. That's when you know that's a content area. You have to go back, remediate that area, build your knowledge, and then move on. That's how you see your score improve. When you are struggling with an area, you have a gap in your knowledge, you address it, you fix it, then you move on. And that's what Kaplan's doing. They're giving you efficient tools so that you can constantly assess yourself and then go back to the content to remediate when needed. It's a lot of information. So it's how do you have all the information you need, but knowing what you need to progress. So when you're following a plan with Kaplan, whether you're studying from home, whether you're studying in one of our classes, whether you're studying in the US, it's a balance of content and questions. In the beginning, heavier on the content, doing questions, but more topical questions. As you progress your way through, less and less content, more and more simulating the actual exam. Okay, so why Kaplan? Well, I hope today was helpful. I hope you got a lot of information about the process and the pathway. I tried to give you as much as I can in the short time that we had, but know that nothing happens all at once. This is a journey that you are embarking on. This is an investment in your medical career and your medical future, and we're going to help you every step of the way. But like we said in the beginning, the more that you understand the full picture, that's how you put yourself in a position to be successful and make smart decisions based on your application, which is what we want to help you do. So Kaplan, we're the world leaders in USMLE preparation. For over 50 years, we've been helping doctors on this journey of preparing for the USMLE exams and applying for medical residency in the US. So really giving you all of the tools that you need to be successful. And at the end of the day, it's your work, right? I always tell students, Kaplan is like signing up for a gym. We give you the tools, the coaching, the equipment, the support, but it's your work that's going to see the results. So we're giving you all that guidance, but at the end of the day, this is your accomplishments, your goals. It's going to get you to the finish line. So what really sets Kaplan apart, number one, it's our faculty. If you've never seen our Kaplan instructors, I would encourage you, sign up for a free seminar that we have coming up. Our teachers are some of the most amazing medical educators around the world. They do an amazing job of helping you integrate the information that you need to know. So it's not just about teaching you concepts, it's about how do you integrate your knowledge in that clinical situation. And that's what our teachers just do an amazing job of helping our students do. And these are not just USMLE instructors. These are doctors in hospitals in the US. They're medical school professors in the US. But like I said, do an amazing job of helping you prepare for these exams. We also have an entire curriculum team of doctors behind the scenes creating our content, writing our questions, making sure you have the most up-to-date information. And then finally, we have flexible options. So whether you want to study in India, preparing with our teachers, with our advisors from home, or whether you want to come to the US, get a student visa, immerse yourself in the US, you can do that as well. So really, whatever works best for your situation and your plan, our advisors can help pick a prep option that'll work best for you. So you're really just thinking about, where do I want to learn? Do I want to study from home? Do I want to immerse myself in the US? We have a Kaplan study location in New York. It's a 6-story building that's just focused for Kaplan Medical students, where you could get a student visa and study for upwards of 21 months in the US while you're preparing for USMLE, while you're doing experience, if that's needed. Any course that you choose, any comprehensive Kaplan course, it's going to come with our core resources. This is where you're building your foundation. Our books, our videos, our quizzes, our questions, our assessment exams, our QBank, which is thousands of questions for you to work on and assess yourself. Any course that you choose is going to come with these core resources where you build your foundation, you assess yourself, you understand your strengths, you understand your resources, and then you're just deciding on the program that's best for you. We have classes with our faculty where you can interact with our teachers from anywhere, just like we're doing today, live online. You are in a room with our teachers, you're asking questions, you're interacting, you're covering the high yield information. The thing that I will advise you about our classes are they move fast paced. They're meant to be high yield. They're meant to integrate the information. So if you're going to take a Kaplan live online class from India, which a lot of students do, it's our most popular option in India, I would say that's a great decision, but you want to spend a few months studying before the classes begin. Sign up as early as you can. The earlier you sign up, the more time that you can before the classes to start going through the online materials, building your foundation, going through your books, going through your videos, identifying those strengths and weaknesses so that when you go into the classes, you have that strong foundation. You don't know how many times over my 12 years at Kaplan, a student would come out of class on day 2 or day 3 and go, the material is going over my head. It's too fast paced. I'm not prepared, because they're not spending enough time building their foundation before. So we have live online classes that start almost every month. So plan 3-4 months in the future. That's when you're going to take your classes at least and start studying before the classes begin. And I want to encourage everybody, we have some amazing representatives in India focused on Kaplan Medical. Abhishek and his team at LogicQuest are local advisors. They're experts on this process, on USMLE, on residency in the US. They've helped thousands of students in India get started on this journey. And they're just a great local resource to have. So you have their email, you have their phone number, you could visit their website and learn more. I would encourage you, take advantage of them. Take advantage of everything that Kaplan has to offer. Free seminars, free quizzes, free trials of our courses so you could see what the online resources are like. All of these things are for you. Again, we're here to offer our support along the way. I hope today was helpful. I hope you got a lot of good information out of the session. But again, we're here to offer our support. So I am going to now, if we can, any questions we have, we'll start rifling through.
So there's a question about the cost breakup of USMLE as well as the cost of Kaplan things, and if there are any scholarships available for either of them.
It's a good question. And generally, in terms of scholarships, there are not many. Sometimes through your school, you may be able to get some types of scholarships. And, Kaplan, we do raffle prizes and different things like that for a lot of events that we do. But ultimately, this is an investment in your medical future. Obviously, the opportunity to earn once you're doing your residency and once you're certified in the U.S. is significant. How much does it cost? It can, in terms of registering for the actual exams and then applying for residency in the U.S., you need to account for about $5,000 to $10,000 US for that part of of the process. And that's, potentially getting experience as well, registering for the exams, applying to programs, and then preparing for the programs with Kaplan. Again, it could range. It's going to be more expensive if you come to the U.S. because you have your living costs while you're in the U.S. The benefit is you could be in the U.S., you could get experience, you immerse yourself, but the costs are a little bit higher. Whereas if you prepare from India, you get all of everything that we have at Kaplan Medical with our advisors, with our faculty, without having to be in the U.S. But again, I would say you still want to prepare about $5,000 to $10,000 for preparing for the exams. So, I would say between $10,000 and $20,000 for the entire process from applying, preparing, getting into your residency. That's sort of an investment that you need to prepare for.
So what is in step 3? And when do we have our ECFMG registration? At what step do we have that?
So in order to be ECFMG certified, you have to finish medical school and you have to have done step 1, step 2 CK, and step 2 CS. This year, it's finish medical school, step 1, step 2 CK, the OET exam, and then you have to meet certain criteria. But normally, you graduate medical school, you finish your USMLE exams, then you get your ECFMG certification, and then you can take step 3. Step 3, it's about long-term patient care. So, step 2 is going to ask you, it's an extension of step 2, but, step 2 is going to ask you, what's the diagnosis? What's the best initial test? What's the best initial therapy? What's the most accurate test? Step 3 says, okay, that didn't work. What are you going to do next? Long-term patient care, unsupervised practice of medicine, but it's just an extension of the information on step 2.
So in which step is ophthalmology and ENT included?
It's a good question. I would say that ophthalmology in terms of being covered on the actual exams is very, very small. They go into some subspecialization, but in general, it's going to be the majority of the main specialties being tested: internal medicine, pediatrics, surgery, OBGYN, and psychiatry. So ophthalmology is a very subspecialized version of internal medicine. So when one exam that we didn't talk about that you have to take is your board certification. So you take the exams, everything that we talked about, and then you apply for residency. So let's say you apply for ophthalmology, which is, I go to an ophthalmologist. That's your residency. You match into ophthalmology. At the end of residency, there's what they call the board certification exam. So if you do internal medicine, you have to take the internal medicine board certification. If you do ophthalmology, it's the ophthalmology board certification. Just basically like a final exam of everything that you learned in residency. And the pass rates are you just have to pass, and the pass rates are very high. They prepare you for these when you're in residency. But that would be the exam that's very focused on your specialty. So, again, if you did ophthalmology, at the end, you would take the ophthalmology board certification, and that shows you are certified in that. But I'd say very little on the actual USMLE exams.
So last 2 questions. One, a person is asking if they can have a post-graduation in India and go to US after that.
Absolutely.
And get the same branch probably for residency.
Well, it depends on the branch. Some branches in the U.S. are just very competitive for IMGs, no matter what your application looks like. So something like neurosurgery, for example, very difficult for international graduates. Dermatology, very difficult for international graduates, regardless of your experience. So like something like neurosurgery, if that's really where your goals are, it's not impossible. It's just very challenging. I think like less than 10 international graduates match into neurosurgery in the last match. So you have to get really strong scores. You have to get good experience, and then even then it could still be a challenge. So you want to do everything you can to be successful, but then you want to think about what other opportunities could be similar that would still fulfill you. I mean, ultimately, this is the next 30, 40 years of your life. You want to make sure you're happy with your choice, but you also want to be successful. I was just working with a student a couple of months ago, applying this year, that really wanted neurosurgery. That's why it's fresh in my head. And based on the application, she was strong, but again, regardless of how strong, neurosurgery is going to be tough. So what we really worked towards were what other options would be a good choice. So we talked about two things: neurology, which again, it's not neurosurgery, but you're still focusing on the brain, and it's much more friendly for IMGs, or general surgery that you get into, which again is competitive, but still more available than neurosurgery. And then after you do your general residency, you go on for fellowship. So you can do general surgery and then go on to dozens or hundreds of different types of subspecialties focused in surgery to get further trained from there. So there's lots of different routes that could potentially get to you to where you want to be. And again, whether you graduate in India and then do your postgrad or not, either way, there's still same process.
So I think the other questions have been answered by LogicQuest already. There's a question about contacts in Uganda, which I would like the LogicQuest team or the Kaplan team to handle, about Kaplan contacts in Uganda. And there was also a question about what to do if your college is not qualified by ECFMG. And I think that also has been handled by LogicQuest. So sir, now I would like to hand over to Leona to give the final parting words.
Thank you very much. Thank you, everybody, again for your time. We're here to offer our support, and thanks for a great seminar and for SNO for putting this together.
Thank you, Nicholas. It was really a pleasure to have you. All of us.
Leona, you'd have to unmute yourself and turn the volume high.
Oh, just a second. Am I still not audible? Just a second. Can you hear me now?
Yes, Liana, go on.
Yeah. Thank you, Nicholas. It was a real pleasure having you with us. And I'm sure you clarified all the doubts that students had. It was really a wonderful session. And we had 15 countries with us today. And a lot of them were from India, but we had people from other countries as well. And guys, I hope this puts you ready and gets your gear going for PanCoff 20. And thank you, Kaplan. Thank you, LogicQuest. And thank you, team. Good day, everybody.